Hi guys, this is Jody Limner. I just want to thank you for agreeing to be faculty members for our GCC Capstone students. They are so excited about this experience, and I think it's really rewarding to see these students as they grow from the beginning of their capstone experience to the end in just the very quick 3 to 4 week period. They really grow so much in that period, and they get ready to transition into that registered nurse role as they get closer and closer to graduation. So it is really an exciting time for our students, and I think it's really rewarding for faculty, but we greatly appreciate you coming in and taking on the role as a Capstone faculty member. The objective of the Capstone experience for students is that they can work with a nurse preceptor and demonstrate their knowledge and skills related to 6 learning outcomes, which are QSIN. I'm sure you're very familiar with QSIN outcomes. So professional behaviors, patient-centered care, safe practice environment, collaboration, healthcare informatics, and management of care. And these are our program learning outcomes related to these. I mean, they're longer outcomes, but they're related to these QSIN competencies, and students will journal to these so that you can see that they're demonstrating their knowledge and skills in that clinical experience. They will have a schedule, which I have on the next slide so you can see that, but students can begin their capstone experience on April 3rd, and they have to complete their experience by May 2nd. They will follow their preceptor's schedule. They need to complete 120 hours. We only allow them to do a maximum of 44 hours a week. That's to keep them safe. The week starts on Sunday, it ends on Saturday, so the 44 hours can be within that time. Now, if they do, a lot of hours towards the end of one week and into the beginning of the other, it's technically okay, but they cannot start more than 3 12-hour shifts in a row. And again, that's to keep them safe. Lunch breaks are included in their hours, so if they're working a 7A to 7P shift, they're going to end up with 12 and a half hours because we know they're going to be there at least until 7:30 p.m. And if they stay later giving report, then they can include that in their time card, I say, and I'll show you that on the next slide. And students have this calendar in triplicate that they will document their time on. So this is the form that students have, this calendar, and it notes on here dates that they need to be aware of. So their first day of capstone, their last day of capstone, and they have 2 graded assignments, and it lets them know when those assignments are due. Now, what usually happens is when the student meets with their preceptor, and a lot of times they end up meeting with their preceptor on their very first day of capstone, they can fill this out with the preceptor's schedule. And so they can note in here like 7A to 7P, but what they might end up documenting is like 13 hours if they end up staying till like 8 o'clock at night. And that's okay because they don't deduct any lunch time or anything like that. So they will document the time, and then on each shift that they work, their preceptor should initial it. It's basically like stamping their time card to say, yes, they were here for these hours. And then at the end, you just want to make sure that, yes, they have completed 120 hours. This is one of the forms, along with 2 other forms that need to be turned in by the end of capstone. So any of the documents that you guys sign, you're going to sign off their agreement form, which I will show you. You're going to sign off on their clinical evaluation tool, which I'll show you. But I say sign them off and let the student hold on to their documents, because the student needs to bring the documents to me, and I have to have them by the end of the semester so that I can say that, yes, the student has completed capstone successfully, and they can that they have passed the course and can move on to graduation. So it's very important that I have these forms at the end. So you can sign them and then just allow the student to hold on to the forms. So meetings that you will do with your student, this is just part of the role as a faculty member, is at the beginning, you just want to touch base with your student. If you are able to meet with your student and preceptor during their first shift, or if they decide to meet prior to starting their hours, if you can be there, great. Realistically, it often doesn't happen because sometimes the students are working night shifts, or, we can't at the last minute, just be anywhere and everywhere. And I totally understand that. So if you're going to be on campus next week at all, if you want to meet with your students then, and you can sign off their agreement form, which I'll show you, or you can touch base with your student via Blackboard message or texting or whatever, just to let them know who you are, how they can get in touch with you, that you are there to support them. That is fantastic. And then you want to touch base with that preceptor too. So if you don't do that at the same time, on that agreement form that you get, you will get an email and a phone number for the preceptor, so you can just reach out. Generally, what I do is in the beginning, I will take all the emails for my students' preceptors, and I will send out an email to all of them. And I will just introduce myself and make sure that they have my phone number and my email that they can reach out. And I do that in addition to my meetings, just so, I don't know, because sometimes I've had preceptors that don't want to say something in front of the student. And so it's just better if they can kind of email me and touch base. So that's kind of how I work it at the beginning. Then in the midpoint of their experience, so after they've completed around 60 hours, and I say around 60 hours because I tried to keep everybody at 1 or 2 facilities. So if your students are, at ECMC, maybe you can group students together and pop in there and see multiple students in one visit. So it doesn't have to be right at 60 hours, but you can touch base, see how things are going, make sure that the student is, progressing well through the experience, and then you can sign off on their midpoint evaluation. Now, if you do this virtually, like via FaceTime or Zoom or something like that with the student and preceptor, just make sure that that form gets signed at the end for the midpoint. And then at the end, the final evaluation after the student has completed, again, about their 120 hours. So if you're trying to group students together, it might be on their second to last shift. That's fine. But you want to be there and just touch base to make sure that the students have met all the outcomes that they needed to meet for the experience. And then you would sign off on the clinical evaluation tool. So this is the Capstone Agreement form I was referring to before. So this is at the beginning. So as you can see, they have supervising clinical faculty. So this would be you. You would fill out your name, your email, sign it, put your phone number and your date. So, again, if you end up signing off on this form at the end, that's fine. But students know that they have to turn in this form to you with their information and their preceptor's information within 24 hours of starting their capstone experience. So if they sign it with their preceptor at the very first shift that they do, they can sign it off and they can send it to you after that shift. But it has to be within 24 hours of them starting, because we have to know that the preceptor did agree to this capstone experience. This is the clinical evaluation tool that I was talking about. And if you have taught clinical, which I believe all of you have, with Genesee Community College, you should be pretty familiar with this form. Now, the preceptor is going to be the one that goes through, this is like 5 pages long. The preceptor will go through and make notes and circle whether or not the student is meeting or exceeding or not meeting each of the objectives in the clinical evaluation tool. They are really the ones that are evaluating them in that clinical setting. You are signing off on this, and it is you as a clinical faculty that makes the decision that yes, the student has passed capstone. So you would, on this very front part of the form, they don't have any clinical absences during capstone, because if they're like sick one day, they'll usually make up their hours on another day. But if for some reason, like they were to get COVID and be out for a week and not be able to get their hours in, then we would need to discuss that and see if they can do a makeup assignment. But generally what you're just going to do is that they met all 47 of the criteria that's in there. Those are all those things where you circle throughout the evaluation. They need to either meet or exceed, because they are at the completion of the program. We do expect them to meet all of the criteria. in order to pass Capstone and move out of the program. So I always say to my preceptors, if you feel like they're not meeting something and you want to say doesn't meet, then they should really be documenting why, so that you can make the determination if, okay, they're not meeting that, but they're still performing well and at the level they should be, that they pass. And if you have any questions with that, please let me know. I also tell my preceptors it's fine to put NA if you didn't have the opportunity to complete something that's in the form. And then you would just say that, check off that yes, they clinically passed. And then you would sign the back of the form for both the midpoint and the final evaluation. Each shift, the student, after they complete a shift, they have to complete a reflective journal. And students are aware of this. I just did capstone orientation with students, but sometimes students forget, so you might have to be on top of them to remind them to complete their journals. I did tell them, if it's something where they're driving an hour away to get to their capstone facility and they have maybe 2 or 3 12-hour shifts in a row, that they can always get in touch with you if they think they're going to be late with their capstone journals. That's completely up to you to set that standard or to say that it's okay if it's late. But generally, they should be turning in their journals within 24 hours of their shift. And that's basically just so we can check in and make sure that they are working their shifts and that they are addressing, one of those 6 outcomes for the program. So again, that's those CUSIN competencies, healthcare informatics, management of care, patient-centered care. So in each journal, they should be, bolding something to say, yes, this journal I'm addressing patient-centered care, and this is how I demonstrated patient-centered care throughout the shift. This is what I learned. So they need to address each of those. In addition to that, they will have a midpoint self-reflection journal. And that should be about, that's after they completed that 60 hours, they should be doing that midpoint self-reflection to see how do they feel, what have they learned, what do they feel they still need to do, that type of thing. And in each journal, they should be setting a goal for their next shift. And what you will do, and what I generally do with my students, is you should be reading and responding to the journals within about 48 hours. So I usually take a few days a week, like Monday, Wednesday, Friday, and I open up and look at the journals and I'll respond to all of my students. Rather than going in like every day and looking for journals, I just do Monday, Wednesday, Friday. I did leave you guys an orange folder in your mailbox at GCC. And in your orange folder, there's a form that has a journal tracking tool. You can feel free to use that or make something yourself to track your students' journals just to make sure that they're staying on track with those. And the way that you access and comment on journals, you guys have access to the Nursing 222 course. So the main things you're going to be looking at in that 222 course are the graded assignments. You'll grade those in there, the journals, and then messaging, because students generally message through Blackboard. So you should be checking those messages. To access the journals, over on the left side of the course in Nursing 222, if you scroll down to Capstone information, there's a little tab that says journals. If you click on journals, it'll take you into the site where it's Capstone Journal, and I don't know, there's something else under there, but you want to click on Capstone Journal. Then it's going to open up the journals, and what you're going to see over on the right is journal details. This is my name here, but you see that there's like this tiny little arrow under my name. If I click on that, it should show you the students that have journals, and you just have to look for your student's name. And if you click on your students' names, it'll open up their journals. And then at the bottom of the journal, there is a spot where you can comment, and you can just comment to your student there. And if you have any issues accessing this at all, just let me know and I will walk you through it. And then they have 2 graded assignments, which you will need to grade. They have a case study assignment and a delegation assignment. There are rubrics in Blackboard, And it's best if you complete the rubrics right in Blackboard with their grading, because then it is always attached to the student's assignment. And if the student appeals anything or there are any issues, we have everything with the feedback right there. So if you can do that, that's great. And I'll show you kind of how you go through and do that. So if you click on the assignment, so there is a tab in Blackboard that if you go down to grading, it'll say needs grading. And if you click on that needs grading, it'll show you all the assignments that need to be graded. And you can just click on your student's name, and it'll show that. Then when you get into the grading, it's going to bring you over here into this assignment details. Now, if you look at this, it'll show the originality report. And because students use a template to complete their assignments, very often you're going to get right around this 29% that looks like it's, could be, plagiarism or something like that. But you can view the originality report and it will show you, that generally it'll highlight what's suspicious. It's going to be like the information that's in the template that's there. So you can take a look at that. If there are any issues or concerns that you have with plagiarism, just let me know. And don't grade the assignment. If you have like issues where you think that there's plagiarism going on, do not grade the assignment. Just leave it blank. Let me know, because we'll have to take a look at it. Because once you put the grade in there and the student sees it, we can't really go back in and change it. So if there are any questions, just let us know. And then to access the rubric, it's really weird because this is going to be all like together. You're not going to see anything. But right around here, there's going to be one of those tiny little down arrows. And if you click on the down arrow, it'll bring you to this, where you can click on delegation rubric or case study rubric, whichever one you're looking at. If you click on that, and then I always just check these two boxes, show descriptions and show feedback, because this will give you all of the information in each section of the rubric. And then you can provide feedback and a score for each section of the rubric. And at the end, it's going to tally your total grade. Now, at the end, you can change that total grade. So say you want to give them like 0.5 points for something. As you can see, like somebody obviously did that here. Instead of being 100, they took off a half a point somewhere. You can adjust that grade. So don't feel like, if you end up scoring it and you're like, geez, they ended up getting like an 80, but I don't think this section was that bad. Maybe they can do that. You can always specify in the feedback, I took off this many points in this area because you didn't do this. And I can't stress enough, we generally see like very, very high scores coming in for assignments. And we look at the assignments and it's kind of not fair to those students who really put in a lot of work and really provide an exemplary assignment, that they get 100, but somebody else who really didn't put in a lot of work and maybe is just kind of squeaking by on the assignment. It's not exemplary. It doesn't go over and above. It's really not fair to have everybody at 100. So really, when you look at these assignments, don't feel bad if you're grading it and the student got an 80. If they deserve an 80, then that is fine. Grade that, and just in your feedback, explain why you took off points in certain areas. Hopefully the rubrics will give you enough information to grade on there as far as if they have stuff, but you're going to have some students that put in a lot of effort and a lot of work and a lot of detail, and other students that just very minimally meet the criteria. So just, kind of look at those and, grade as fairly as you feel that you can. And if you have any questions or concerns with grading, let us know. But, it is a lot of points for students to get on these assignments. They get 5% on each of these assignments that goes towards their final grade. So we really want to make sure that what they're earning is truly what the work that they put into these assignments. The other assignment that they have is that case study assignment. I'll go back here a second. The case study assignment, I tell students, pick a complicated patient. Because if they pick a complicated patient that's got a lot of issues going on, they're really studying for their final and they're studying for their NCLEX as they really put a lot of thought into that case study. So, when you look at that, I would try to see, are your students really picking these patients that have a lot of stuff going on? the evaluation piece. So at midpoint, at about that 60 hours, you want to touch base with the preceptor and the student. It's great if you can get to the facility and meet with them in person. If it's not possible, a phone call, to the student when they're with the preceptor. I've done FaceTime. I find that's easier than Zoom for the student, where I can kind of talk with the preceptor and student and see how things are going. And that has worked pretty well. So if you can get to the facility, great, because then you can sign off on their paperwork. But if you really can't, you can just meet virtually, that's okay too. Again, that student should be doing the midpoint self-evaluation, and that is in their journal. So after they've completed that 60 hours, they should be doing a self-reflection midpoint journal. And the students have examples of journal entries, so they can look at those and kind of see what they should be putting in that. And then again, the final evaluation, and again, the preceptor is the one that really should be filling out a lot of the detail on the clinical evaluation tool. You are just meeting with them, making sure everything's going okay, and then signing off on that. So by the end of Capstone, they should have that Capstone Agreement signed by you, and they should have their clinical evaluation form signed by you. And you should have checked their calendar to make sure that they have completed 120 hours. And then if there are any problems during Capstone, if your preceptor, is telling you there's issues with the student, if the student isn't turning in graded assignments, or the student is giving you any issues about how you graded their assignment, if they've missed, if they've been ill and they've missed shifts, if they've had a fall, or we've had students who have had needle sticks. I had one student who passed out and had rapid response called on her while she was at the hospital. Of course, the hospital is going to follow through, and they should be following any hospital policy for injuries that happen. But because they're still a student of the school, we need to be made aware, and we do have to fill out an incident report. There is one in your orange folder. And I can certainly help you with that, but you would just fill it out, and then you can send it to me, and I can send it over to the security office. But we just need to have record if there's any injury, or incident that occurs during Capstone. So just let me know of anything like that. Any questions, let me know, and I am happy to answer them for you. And then thank you again. We greatly appreciate this. It's really, again, I think it's a rewarding thing to watch students really grow throughout this Capstone experience. And, they always enter and they feel like, I am not ready to graduate. And then by the time they finish, most students say, I feel like a nurse. So it's really great to kind of watch them grow like that. And again, please let me know if you have any questions or concerns. And I look forward to meeting you guys and working with you, and I hope you guys decide to do this again. All right, thanks.